I was saying it's really great to be here with this huge crowd right after break. I know all of you rushed back in to be able to see what the one of the sponsors was going to say. It's our privilege to be here. This is the third year that I've been at the Free Market Medical Association meeting, and each year it just seems to, the level of incitement, the maturity of the ideas and the thoughts that come together just seem to continue to grow and grow. And this year I'm really privileged to have with me two other members of the Christian Healthcare Ministries, Dr. Carol, who is a member and a board member of the ministry, and a practicing physician. She is with us as well. And then also Charity Bell, who is our Chief Financial Officer. And Charity has been with the ministry for quite some time, actually came to the ministry in doing one of our annual audits and fell in love with the concept of what the ministry does and has stayed, and she's the Chief Financial Officer and helps to guide us through some of the things. So it's been a privilege to have them with me as well. A little bit about Christian Healthcare Ministries. 37 years ago, a concept was brought together that actually was a resurrection of a concept that was in place well over 2,000 years ago. At that time, there was a physician that had a phenomenal cure rate. In fact, actually, he healed every patient that he came in contact with. And he also had 11 very high-quality men of integrity that were TPAs, and then one very nasty broker. Now, I realize that all brokers aren't like that, but this one was, and he didn't last with the organization. The ideas went over well where the members of the body of Christ would share with one another, and you'll find out that we unabashedly are a Christian organization. Our members are those who have signed a statement of faith saying that they are a Christian both in life and in conduct, and as such that they're joining with us to help share the medical cost of our other members. And to give you a little structure of the way that the ministry works and some things about us, we practice in all 50 states. We share 100% of all of the medical needs. Our members can select any physician or facility that they trust. We make no restrictions on where they would get care, providing it's traditional health care. And we provide services in all 50 states and plus to many missionary organizations around the world. At this point, we have over 300,000 members. If I were to look at the area around the state of Oklahoma, we have over 70,000 members in Oklahoma and the surrounding states. So those are the people that depend on our organization. We are accredited by the Better Business Bureau. We are defined by the ACA as a health cost option, in that members of the Christian Healthcare Ministry are exempt from the provisions of the Affordable Care Act. So that means not only no penalties, but there's also no requirements on them to meet some of the things that trouble our conscience. We require a pledge of faith only for membership. So that means we accept pre-existing conditions, and we do not do any pre-screening or pre-requirements. There's no membership fee to become a member. You just go through the paperwork that allows us to identify and understand who you are, and then tell us when you want the program to begin, and billing then is scheduled appropriately from that time. We share 100% of eligible medical needs all the time. In our 37 years, we have paid 100% of every one of the bills that members have presented to us, either through negotiation of the bill with the provider or with providing the member with a check to cover that cost. We're a biblically based organization, as I already alluded to, following the model in Acts chapter 2 and 4, and also in Galatians chapter 6, which states language there about the members of the body of Christ sharing the burdens of one another. And in that, we provide programs for pre-existing conditions as well. And so we're very happy to be here, and we find that the work that we do in our ministry just meshes extremely well with the operation of the things that take place within the Free Market Medical Association. And we're looking forward to a very fruitful relationship into the future. Thank you very much.